Welcome to the Doherty Water for Food podcast. Since 2010, the Doherty Water for Food Global Institute at the University of Nebraska has worked toward one goal, a food and water secure world. One in which global food security is ensured without compromising the use of water to meet other essential human and environmental needs. It's a daunting vision, but one that is vitally important. This podcast amplifies the voices of those making waves in this space. We hope you enjoy today's episode.
Hi, I'm Frances Hayes, Director of Communications and Public Relations at the Doherty Water for Food Global Institute, and your host for this episode of the Water for Food podcast. Today, I'm excited for the chance to catch up with Claudia Ringler, the Director of Natural Resources and Resilience at the International Food Policy Research Institute. IFPRI works around the world to sustainably reduce poverty and end hunger and malnutrition. Claudia recently provided the Heerman Lecture keynote at the 2025 Water for Food Global Conference, which I encourage all of our listeners to take a look at. We'll link to that talk in the show notes for today. But today we're going to continue to explore that same topic of how irrigation can really move the needle when it comes to global nutrition and health. So let's dive in. Thanks so much for talking with me today, Claudia. I'd like to first talk a little bit about what got you inspired to get into this work. I understand that you've been involved with IFPRI in various capacities for the past 29 years, so that's incredible. And you hold a master's from Yale in International and Development Economics and a PhD from the University of Bonn in Ag Economics. So my question is, what made you decide to pursue this career that you've held for 3 decades now, and what got you into that in the first place? And maybe you can talk about even a little bit about how it's changed over the years.
Okay, thanks for this great question and a nice introduction. So yeah, my story is maybe like that of many others. So I actually grew up in a very rural area. It's a very small village, with maybe back then 3,000 people. And so my goal was basically to get out of this rural setting and into the big world. And so I was looking for, to study something where I can work anywhere in the world, where I can meet new people, learn about different cultures. And so actually my undergrad was in business administration. So I thought, that's the easiest way you can work anywhere you want with this job. But then I realized, that I was looking for something more meaningful. I was really interested in development, also much more interested, to work and engage and live in low and middle income countries. And so that's why then I realized I have to go right back into rural development and agriculture, kind of the area that I wanted to escape from. But yeah, I just basically figured out that that's where my future would be. And so that's why I switched from business administration for my master into international development economics and then agriculture economics. And that's pretty much why I landed at the International Food Policy Research Institute, which, has probably one of the most beautiful visions and missions, trying to address hunger and malnutrition sustainably in the world. So it's a pretty big ask. What has changed is, that we were seeing a lot of positive outcomes of our research. Obviously, hunger and malnutrition have been declining dramatically. When I, started in 96 and even into the first decade or so, we were really talking about working ourselves out of a job. So this is what we were thinking, fewer and fewer of us would be needed. Food security was improving quite rapidly. And so obviously what has changed in the last decade or so is that the food insecurity indicators are moving in the wrong direction. Hunger and food insecurity are now rapidly increasing for a variety of reasons. So basically whatever we had done before was not sufficient. Agricultural productivity growth wasn't sufficient. Any efforts towards improving equity in the world so that poorer people actually have the resources to access food were also insufficient. And now we almost seem to be on a, irreversible trend in the other direction, at least for the foreseeable years to come. So not just another 1 or 2 years. I think now we're talking about, at least 1 or maybe even 2 more decades, because funding for agricultural research has been going down. Global interest in addressing inequity issues has also slowed, or interest has been diverted into other directions. So I guess the big change is that now we are kind of in a race, against really a race, trying to address undernutrition while seeing that we actually cannot make sufficient progress, just given this very large underinvestment. And obviously underinvestment is in ag research is one part of it, but there's also just no political will that's currently there to make a difference. So that it all has to come together. And so it's obviously a very still, even I guess to some extent, a more exciting career, but also much more challenging to have a career in this field because of the rapidly shrinking resources and interest, which makes it just difficult to have resources to even attract talent into this field.
Yeah, thank you for that, Claudia. I think it just shows how important roles like yours are and how they're needed now more than ever. And it's disappointing to hear what you were talking about with the trends going in the wrong direction. For our listeners that might not be familiar with the term development, I was just wondering if you could talk a little bit about what exactly that means in relation to what we're talking about today.
So development, especially agriculture development, has many different areas. And so International Food Policy Research Institute, where I am working, covers a lot of these areas. So nowadays we use the term food systems. So we would like to enable low and middle income countries to be able to invest in the right, accomplish the right investments, develop the right enabling frameworks, and also the supportive institutions so that populations in their countries are able to access sufficient and sufficient and food of sufficient quality and diversity to lead healthy and productive lives. So the specific areas that we're focusing on are on the food production side, what can help to improve productivity in agriculture, because that's often still, the agri-food system is still where most of the population in low and middle income countries are engaged in. Most often informally, so not as a wage earner, but it's usually farm families or people are, just working on someone else's farm, getting some kind of compensation. So we're trying to improve productivity so that farmers have enough income to send their kids to school, and obviously to improve their livelihoods, and also just to lead healthy and productive lives. There's also a lot of development activities are going on in developing markets. So market systems so that farmers can access seeds, other inputs, but also that they can sell their produce, what they have been producing at a profit. So if these markets don't work well, then obviously farmers lose out, and also the consumers. We are all consumers, but obviously the majority of consumers are in low and middle income countries, so that they can also access food at affordable prices. So that's why markets have to work. And then the other part of the other side of the same food systems development support is improving diets and nutrition. And so that includes not only improving food production systems, but there is a lot of education, awareness of what a healthy diet constitutes. That's obviously something that has to also be done globally, not just in low and middle income countries, but it's important, particularly in low and middle income countries where the resources are much more constrained to get access to a healthy diet. So what can be done to improve diets there? How can we especially improve diets of adolescent girls and women? Because if their diet and health is insufficient or has deficiencies, that means the diets and the birth weight and the health outcomes of their children will likely also be affected. So it's kind of an intergenerational challenge, especially on the diet, health, and nutrition side. So there is, again, a lot of interventions, how to support, particularly those who have the largest problems to access healthy diets with social system programs. For example, there's research, should it be cash or should it be food? Should it be in kind? Should these resources go to the mothers? Should they go to the household? Should they go directly to the children as school feeding programs? So there's a lot of there's a lot of research that has to be done to identify development strategies that work, of course, differently for different countries.
Thank you. I think we talk about the development a lot, but it's nice to kind of define that and set us up for future discussions. So now that you've defined this big problem that we have that you're working towards, can you tell me what excites you the most about your current position at IFPRI and what keeps you going at it when it might seem overwhelming sometimes?
Yeah, that's definitely well said. Overwhelming is definitely a term that I think fits very well right now. Yeah, and so basically for the last 2 years, I have been the director of natural resources and resilience. So again, it's a big topic, and some people might say, why do you work on natural resources and resilience when the Institute's goal is addressing food security, food insecurity, and hunger? So basically, our natural resource base is the foundation of all food production and also of all livelihoods and of all life. So if we can protect our water resources, we can protect our agroecosystems, it's unlikely that we can continue to produce food. And obviously, with our current population growth, with already a lot of adverse reactions from nature, such as climate change, in response to the way we have been treating our ecosystems. Basically that's kind of the focus of the unit that I'm currently leading. And what excites me particularly doing this is just to see staff grow, see collaborations being made, collaborations leading to great research results, leading to impacts, leading to changes in how countries, policymakers, farm communities manage their natural resources for better food security and health outcomes, and obviously also for better environmental outcomes. Yeah, so I think that's what excites me the most.
So for those in our listening audience who haven't had the opportunity to watch the Heermann Lecture, which I encourage everyone to do, can you give us a brief overview on the linkages between irrigation and improved health? What are some of the key negative health impacts that can arise from either poorly designed irrigation systems or just a lack of irrigation?
Thanks. So yeah, I really enjoyed that lecture, and anyone who has time or should definitely maybe watch it, because I think it was just a great event. And also I think it was a special anniversary. Dr. Heuermann, I think, also had passed. So I think it was a very special year to give the Heuermann lecture. In terms of the linkages between irrigation, nutrition, and health, at IFPRI, with partners across the world, and of course in the US as well, we have looked into various pathways or various linkages between irrigation and nutrition and health. And those are 4 pathways that are hopefully positive and generally are positive. And there's also, as you already mentioned, some potential negative pathways. So the positive one, the first one is production. So if you have a rain-fed agricultural system, let's say in Africa, or you have an irrigated one, we generally see higher yields. So it means increased production on the same piece of land. Same piece of land is, of course, important because we still have very important tropical forests remaining in low and middle income countries. So obviously, everyone will know the Amazon, but there's also the tropical forest in the Congo Basin, which is the largest remaining tropical forest in Africa. So we would like to protect that. And one way to do that is, to just irrigate one piece of land instead of having much lower yield on a rain-fed piece of land and then having to expand land area, which is what traditionally has been happening in sub-Saharan Africa and actually continues to happen at a far too rapid rate because of population growth and other challenges affecting agriculture that keep agriculture yields low. And of course, underinvestment in agricultural research is one of these factors. And so production pathway, so we can have better nutrition from more food production on irrigated land. The second pathway is the income pathway. So we are, obviously in the West or in the rich countries, pretty much everything that we grow, let's say in Nebraska, we are not using it for own consumption. We are selling it. So it's commercialized. In sub-Saharan Africa, that same trend is also coming along, and there's pretty much no farmer out there who doesn't at least buy something, oil or sugar. So there's always some commercial transactions are happening, and pretty much all farmers who grow food will sell something. Right? They will not just consume all of it. In addition, also because they have to buy something, so they generally have to sell something too. And so if irrigated production, for example, in the dry season, when the irrigated area generally doesn't cover that much area, it is not 100%. But if I'm a farmer who has irrigation, and then in the dry season or in the wet season as well, I can generate income because I'm producing something that my neighbors cannot produce or do not produce, can sell it. So I generate income and buy, hopefully, a more diverse diet, moving beyond the cereals that the farmer might have been producing in the rainy season, and instead maybe, also consumes vegetables or fruits, or even use it to water livestock, and then get additional income from selling those products. So that's the income pathway. The third pathway is what we call the WASH pathway, which is the water supply, sanitation, hygiene pathway. So most of the water in the freshwater resources that people withdraw on the globe are used for irrigated production, but a substantial second source or second water user is our domestic use for showers, whatever it is. In low and middle income countries, in the rural areas, we often don't have very good domestic water supply. So if farmers have an irrigation water source, a well or whatever it is, they develop it for irrigation, but very likely they will use it for domestic water as well. So these multiple use systems are very common. And so domestic water and drinking water in particularly are essential for good nutrition and health. So we need a sanitary environment in the house. We need to be able to wash our hands after going to the toilet. And irrigation is actually a pathway to achieve that. And so that's why we call it the WASH pathway. And while it's a positive pathway, we have to be, of course, very careful how the irrigation source is developed, that it stays clean, especially if we also use it for drinking water. And the last positive pathway is the women's empowerment pathway. So women generally still are in charge of putting food on the table, not necessarily that they generate all the income, but they have to do the cooking and they have to do the food preparation. So if women can actually decide what is being irrigated and also how the irrigated produce is sold, and if they can hang on to some of that income, then we can also improve nutrition and health outcomes because they have very specific interests in what they want to see grown in the field in terms of herbs, in terms of vegetables, in terms of fruits, and because their job is to not just serve cereals every day, so they would actually like to serve more diverse diets. A second pathway that can empower women is, again, if the water source, irrigation water source, is close to the homestead, which it often is in these smallholder settings in sub-Saharan Africa. In those cases, they don't have to go 30 minutes or more to collect water for domestic purposes. So that's another way to empower women because they can use that time to generate income, to take care of their family members, or also just for leisure, because women are very often overworked in these settings because they have so-called productive uses of their time, which is working on the farm, but also these so-called reproductive or domestic uses. So they also have to cook, take care of the children, maybe oversee some homework. And so any time that we can reduce, any time we can save for them, for example, through a mechanized irrigation technology, or through, avoiding they are going very far to collect water for domestic purposes. So that is another win-win. So it's another pathway to improve nutrition outcomes through irrigation development. There's always a risk around all of these pathways, and there are some specific risks related to water pollution and to waterborne diseases. So again, in low and middle income countries, particularly in tropical areas, we have, as an example, malaria. There's a waterborne disease. So if there's a lot of standing water, which can often happen in irrigation systems, that might lead to, increased development of mosquitoes that carry the disease. And so there has been some research that has shown that in some larger irrigation systems located in specific areas, so it depends where, it can increase the incidence of malaria. There are, of course, also other waterborne diseases, but malaria is everyone knows usually what malaria is about. The other challenge is, of course, water irrigation and water-related pollution. And so the agricultural production, when farmers actually invest in irrigation technology, it's generally costs quite a bit of money, but it also very high potential to increase outcomes and production and yields. And so they then also tend to invest in fertilizers and pesticides, obviously improved seeds. And what we have seen in many, or in some occasions at least, is that there's an over-application, especially of pesticides. We're talking about farmers producing, for example, in a dry season, they produce vegetables and fruits, and you look left and right, and it's pretty dry. So all of the insects, etc., will of course come and go for this. Will go for the smaller areas that are irrigated, and so farmers tend to actually apply sometimes quite high levels of pesticides that can in turn affect the drinking water, and so that's why, again, irrigation has a very high potential for positive nutrition outcomes and health, but only if we are very intentional about it, and there is training and capacity sharing accompanies the irrigation development, so that farmers are trained on integrated pest management, and also on the important preservation and conservation of water resources for drinking, so that they're not contaminated. And the same from livestock, because livestock, of course, will also rely on these water resources, and they can contaminate drinking water sources as well. And so that's another potential risk. But again, it can be managed if if communities come together, also if the government jointly understands that all of these goals have to be met together, and then actually sit down and develop the resources and work with the farmers to basically help them meet all of those goals together, because the farmers will obviously want to develop all of those goals together. So the drinking water, the domestic water, and the irrigation. So those are some of the risky pathways. At the same time, there's obviously some other accompanying challenges. One is inequity of access to water resources. Whoever is better off generally will more rapidly develop water resources. Both surface and groundwater resources and surface water resources are shared. They're shared resources. So if I dig a well and I take out a lot of water, my neighbor, who might, say, okay, next year or even next week, they also want a well, and they might just find less water because I might have all pulled up all of the water from the surrounding areas. So sharing water resources, developing some institutions for water sharing, again, building the capacity for communities to understand how they can jointly manage ground and surface water resources is another risk if it's not being done, in terms of potential negative impacts. But again, it's an area where we also do active research, others do as well, and just an area that has to be considered when developing a nutrition-sensitive irrigation.
That was a really great summary, Claudia. Thank you. I think it speaks to the need to, first of all, involve the communities in the decision making that's happening, so we don't get unintended consequences that maybe those trying to implement the solutions don't understand. Also, it seems to be a lot of similar issues seen around the world, even where I'm from, which is Nebraska, of, not wanting to contaminate water in my community or pull too much water out. and having everyone have that shared resource and keep that around to be able to use. I think also the last two pathways that you mentioned are ones that I always kind of forget about, of being able to use those wells that you might initially use for irrigation to have clean water, drinking water, hygiene, those type of things. And also the point that you made about women's empowerment as well, of not having to travel so far to get water, and either giving them back some of their time, or having things be less strenuous for them so that they can participate in other necessary daily activities. So that was a super great summary. So thank you for that. You kind of already touched on one of the things I was going to talk about later, which is the potentially negative impacts of irrigation. And I just wanted to point our listeners to an episode that we did earlier. It was episode 38, about kind of some of these impacts of irrigation. And I think that doesn't negate the overwhelmingly positive impacts that irrigation can have in those areas, but just gives us kind of another lens to look at things to make sure that we're not having these unintended consequences, and that we're really like looking at the big holistic picture of irrigation and nutrition. So I encourage our listeners to check that out. But now I wanted to talk about some specific examples that you might have, like success stories in these irrigation projects where they've shown to really improve positive health outcomes, and what made those successful. What are things that maybe we could replicate elsewhere or in different instances that have either been surprising or inspirational?
Unfortunately, we don't yet see a lot of irrigation development that intentionally focuses on improving nutrition. There are some efforts that specifically focus on what we traditionally call kitchen gardens. So kitchen gardens kind of fulfill a lot of those pathways that I had mentioned. So they're called kitchen gardens because they're just behind the kitchen. So they often use, I guess, the rest water, from household, whatever people have used in the house. Could be the rest of the cleaning water, the cooking water goes right out there. And what they do, and there are, as I said, some efforts and projects that have specifically supported those. And so they always support women farmers. They always directly work with women farmers. And as I've already mentioned, there is the women's empowerment pathway. So in a kitchen garden, you're less likely to find men tending a kitchen garden than women. And so the women's empowerment pathway, for them to actually decide what's being grown there, for them to actually then help to diversify what's on a meal plate so that it's not just cereals, and to grow the number of food groups that they can serve. So that's another good outcome. These particular pathway, the kitchen garden intervention doesn't do that well on commercialization. So you generally do not generate income, and you don't necessarily produce that much more, but it helps. So it's one type of intervention that has always shown promise. So it's almost always does. Of course, again, one has to be careful what water you put on those crops. And you also have to be careful, if animals get mixed in, or if there's a drinking water source that might be affected. The other parameters that work is really ensuring that women are engaged in farming and irrigated farming. And then again, we can see that the kind of crops that they're growing are more diverse, and that these crops, the more diverse crop production, improves household dietary diversity. That can be done in small scale irrigation. In larger scale irrigation, where women are very often less engaged for various reasons. The systems might be further from the homestead. It's commercial cash crop agriculture. But in those larger scale settings, women can also still be engaged, because some of those sources are often still also used for domestic water, and water user associations and water user groups can be mixed. So basically there could be a rule set up that 25% of the positions in the water user group that takes decisions, for example, on which fields gets water when, and so forth. If women get some slots on these water user groups, that's another way to, more likely than not, improve the nutrition sensitivity of irrigation. In Ethiopia, a lot of the irrigation, much of the irrigation is small scale irrigation. Our research has shown that just by focusing on small scale irrigation rather than the larger schemes, that we do see increased production of fruits and vegetables, and that this production then directly, especially in the lean season, again in the dry season when there's very limited food production going on, that it can really reduce the seasonal variation in women's diets. And reducing means reducing the very low variation of diets with just, 2-3 food groups out of 10. So just basically cereals and almost no animal source foods. So we can make a difference in the lean season through irrigation. And again, small scale irrigation also supported health outcomes in avoiding this disease vector such as malaria. So in that particular study, we looked at the diets and calculated calories, energy intake of women in 3 different time periods. So the lean season, the harvest season, and also the production season. So just to see, when does irrigation make a difference? And unsurprisingly, small scale irrigation, where women have at least some say, and where farmers directly control what water is applied to what crops, directly supported dietary outcomes. And because most of the water sources were groundwater and not these large standing water bodies, we also found 0 incidence of malaria. So we specifically also tested for malaria because of this potential negative pathway. So Ethiopia doesn't have a specific nutrition sensitive irrigation policy, by the simple fact that a lot of the irrigation that takes place is directly by smallholder farmers using their own irrigation technologies. They have inadvertently actually directly improved nutrition by, not drawing from large standing water sources. So they avoided the malaria by actually being able to grow production in the lean season. They have increased the number of food groups available for women. And that obviously is very important for birth weight and also weight gain of mothers during pregnancy. So very important health and nutrition outcomes.
Interesting. Thinking throughout all of your work, what policy changes or international collaborations do you think are the most critical or the low-hanging fruit to maximizing the potential health impacts of irrigation and minimizing risks at a global scale?
Yeah, as you said, at the end, a lot of these things have to happen at the local scale and supporting enabling environment at the national scale. But it would, of course, be great to see some signals at the global scale. And I think it's a timely question because next year we have another big UN water conference. We've had one in 2023 after decades of not having any conference, and now they have another one in 2026. And that particular conference, I think, would be a great opportunity to be more serious about the benefit streams coming out from water, including nutrition, livelihoods, income, employment. If the water sector or irrigation sector would more actively engage with the other communities. So right now we have a so-called United Nations International Decade for Action on Water for Sustainable Development that started in 2018 and it ends in 2028. And that conference in 23 was actually a kind of a stock taking. But what that particular United Nations Decades does, it focuses very much on SDG 6 on water and sanitation, and it's really just focusing on water. And, obviously there's a drinking water component, there's a sanitation component, there is a environment component, but it doesn't really go into food and nutrition and health. And so I basically would urge this particular conference to look really into the many development outcomes, including nutrition and health, and to highlight those important outcomes and to ask for collaboration with nutritionists and health experts and also agriculture experts and ministries of agriculture, because most of the water that humans take out or that they withdraw and they use is for irrigation. But it's not irrigation, just to use water. It's irrigation for food and nutrition. So basically having the water crowd at this UN conference, or of course, ideally before, actually talk more actively with agriculture and irrigation experts, or irrigation experts also talk more actively with food security and nutrition experts would be great. In parallel, we have another decade that specifically focuses on nutrition, and it's called the United Nations Decade of Action on Nutrition from 2016 to 2030. So they have been operating in parallel, but they really have not operated together. So the nutrition decade doesn't really talk about water at all, beyond WASH. So because you do need drinking water for nutrition. You cannot live very long without drinking water. And WASH means also the understanding that if you don't have a sanitary environment, you're much more likely to be sick. But that's where they end. There's no recognition that there would be no food without water, and that there would be no nutrition without water. So these two decades have been nicely operating in parallel and not together. We actually wrote a paper about that 7 years ago, and I think nothing has changed. And so again, this conference is an opportunity at the global level to try to come a bit more closely together and to try to say, okay, nutrition and food security are joint goals that both of these decades would want to achieve. And then what kind of guidance can they give? For example, the Committee on World Food Security could provide a guidance on sustainable water use in agriculture, and basically, really nudge countries and nudge governments to develop more integrated plans. So not a separate food security plan and not a separate water security strategy that don't talk to each other, because it's unlikely that then we can achieve these joint outcomes that we want. But as I've mentioned, even more important is more action at the national levels and also at the subnational levels, where again we have ministries of agriculture, we have ministries of water resources. Irrigation is often split, so large-scale irrigation with concrete and a lot of money is usually in the Ministry of Water Resources, and the small-scale irrigation that no one really knows how much is out there is with the Ministry of Agriculture. And that, unfortunately, it could lead to collaboration, but it doesn't. It actually seems to lead to more conflict because no one knows where their irrigation ends. Or irrigation is nowhere because everyone thinks it's with the other ministry. So like having those two ministries talk to each other, obviously also with the Ministry of Health, because waterborne diseases, important health indicators are directly linked with how water is used in food production. And of course, irrigation is a very important component, but as I said, we also need water throughout the whole food system. We also use water for processing and even to cool as ice, to cool perishable foods, etc. So water plays a role actually throughout the entire food system. And there's no agency there. There are no policies that are actively pointing out those linkages and then actually come up with some interventions to make sure that we achieve both of these goals together: water security and nutrition security and health, of course. There's still a lot that needs to be done. It's always challenging to overcome these siloed mandates of different ministries. But now maybe with, the whole food systems approach that goes beyond food production, the word system suggests that they're interlocked systems. So food system doesn't operate on its own. It's linked with water systems. It's also linked with energy systems and so forth. So they're all in all, there are more entry points now. Also, I guess another entry point is growing. It's climate variability and increased climatic extremes. So we see more droughts. We also see more floods. And so that directly affects food production systems. And again, there's a very clear linkage that to reduce the adverse impacts on food production systems from these extreme events, water as a resource has to be more actively considered in food production systems. How can water make a difference? So maybe that will lead to more communities coming together.
Well, I definitely second the recommendation of furthering the link between water and agriculture. I think that's really key. So I hope whoever is hearing this takes you up on that recommendation. So, well, that is all that I have for today, but I wanted to give you the opportunity if there's anything that we didn't discuss or comment on that you would like to, or any parting words for our audience, that I give you an opportunity to do that.
Maybe just to say this podcast is out of University of Nebraska, the Dowdy Water for Food Global Institute. So I've been trying to say there's a lot of capacity sharing. There's a lot of capacity needs to be built, I think with students as well, but also a lot of capacity that needs to be shared with extension systems, with irrigation engineers, with ministries of water on the food side and nutrition side, with ministries of food on the water side. So this is obviously just a plea to University of Nebraska students and future students, and also the Dougherty Institute, to continue to focus on this topic. That's really not going to go away. And this is an important entry point, an important positive set of interventions that can be undertaken, but it really needs this interdisciplinary and also transdisciplinary set of approaches that I think Nebraska would be, an excellent university to push forward.
Well, thanks, Claudia, for sharing your expertise today and continuing this important conversation on irrigation and nutrition. I don't think it'll be the last time that we talk about it, for sure. I just really appreciate time and insights, and thank you for joining us today. This concludes this episode of the Water for Food podcast, and join us next time for another insightful conversation on the critical issues of water and food security.
Thanks for joining us this time on the Dougherty Water for Food podcast. Make sure to visit our website, waterforfood.nebraska.edu, to view show notes or subscribe so you don't miss future episodes.